talk about pain management cats, and that's me. And I graduated a long time ago from Purdue University, very, very good school. And this is where I work, at Big Creek Cat Hospital. And we have two locations. One is in Middleburg Heights, right off the I-71 and Bagley Road. There's Bob Evans on this side, and then that's us. And our other facility is out in Olmsted Township. And this is in front of the swings and things out there, if you've ever been out that direction. And that really is my associate doctor. He's 6'8". So he humbles me. The topic today is your cat in pain? And it is always a challenge to know that, because cats are unique creatures who don't want to show you that they're in pain. So first thing we need to do is define what pain is. And pain is defined as a physical suffering or discomfort caused by illness or injury. Synonyms: suffering, agony, torture, torment, discomfort, hurt, ache, throb, sting. We know what pain is. Pain just plain hurts. It reduces the quality of life dramatically. And we've all had moments even in our own lives when we understand what pain is. So we're trying to find out how we know that in cats. When might your cat be in pain? What kind of things might cause your cat to be in pain? Pretty obvious, and some of them, others maybe not so much. Trauma, and we see a lot of that kind of thing. The cat fights, or the falling off the top of the credenza, or the hit by car for ones that are outside. Bladder pain, we just did that with cats. That when they get those inflammatory ulcers in their bladder and they're bleeding and they're squatting. Bladder pain. Kidney pain is different. It's up in your back. And we do see kidney infections in older cats. Pancreatitis, both acute and chronic pancreatitis, a real epidemic actually in cats that is very, very painful in the midsection. This one will accompany with, usually in cats not eating adults, we see them vomiting, cats hiding away, they just don't feel good. Dental pain, both from just the inflammatory processes that goes on in the teeth as they get dirty, and also lesions in the tooth enamel itself that go into the live part of the tooth. Eye ulcers, we see this sometimes because they play so hard. And one moves the wrong way and gets a scratch on their eye. They come at you like this. Blood clots. This is we aren't seeing as many as these, thank you. This was a bane back when we didn't know that we needed to put taurine in the cat food. And so we were getting a lot of the thickened parts, and when the heart got thickened, the blood swirled and it released the clot. It showed up at the end of the aorta where the blood vessels go back down to the back feet. And it would settle in the middle of that or to one side or the other, and that leg that was infected didn't have blood supply, went numb, and it really hurts. And of course surgical pain, which I'm involved with all the time to try to correct the things that happen in life. The biggie is arthritis. I think this is kind of the new area, because we've chosen to ignore arthritis in cats because they don't tell us, they just sit. But if you are alert, and if you watch your cat, and if you know what he used to do and what he's doing now, it's not old age, it's pain. The study at Texas A&M University, this was amazing to me. 90% of cats over 10 years old have X-ray evidence of arthritis. And 1 out of 5 cats, of all ages, have arthritis, according to the Colorado Animal Pain Center. That's epidemic proportions in my mind. And and we haven't done very much to deal with it. Part of what happens is the way that a cat moves, because a dog trots, a horse trots, their back stays flat. That's why you can ride a horse, because their back stays flat as they move. But a cat folds, so their back accordions all the time. It puts a lot of stressors on that backbone, and will ultimately get some injury there. The cartilages wear out. The body tries to keep it from hurting, and so it tries to bridge those vertebrae so they don't move anymore. That bridging is what we call arthritis. And if any of you all have had an 18-year-old cat or more, you've seen it. It's the cat, instead of a nice flat back, this guy is running, instead of a nice flat back when you see your young cats over there, they have a hunch. And that's because their spine has been fused because of all the damage that has happened in those vertebrae. So a very unique situation.